everyone. Um, we almost have a quorum, but not quite. Although our chair is here, he can actually make us a, I think. Not sure. Not sure. No, but you can't. Okay. But that's fine. And we have about 9 persons on our Zoom right now. Okay. It's been a wonderful holiday weekend, and some people may be recovering from that. But I'm glad that you're all here, and because of our agenda, I'm going to work to keep it, tight. So the meeting called to order at 6:35, and I'd like to our members to adopt the agenda or add any correction changes. Okay, Heather has been and Lena has seconded the motion to adopt the agenda. I see Cameron has joined us at this point, so technically we have a quorum because there are more of us here than in Zoom. In terms of the minutes, I actually did the majority of the minutes within 2 days after our last meeting, but I didn't have time to finish in the week and a half or 2 weeks after that for various reasons, primarily because of my work schedule. But I'd like to offer completing them before the week is out and emailing them, and we take a vote offline for that. Can I get a motion to accept that? And then we would be able to present our meetings at the executive committee. Okay, look, that's been moved by Lena. Yeah, say that.
So I move that we approve the minutes at the next meeting after you. No, sorry, you're gonna email them to us and we'll approve them today.
Yes, this week. Heather, are you seconding? Okay. Thank you very much. And okay, so we'll have that out of the way, at least for the executive committee. And I might even be able to have the December minutes ready so that I might, I don't want to promise that because really they need to be by the committees. Okay. All right, there are a couple of announcements, and I think one of the things is that we acknowledge and recognize that today, December 1, is World AIDS Day. I know there are a number of organizations that provide that recognition to show how far we have come in empathizing with those who have the disease, and also paying tribute to advancements that have been made in medicine. There's still big issues internationally with that, and have to still work to lead to a better peace. Are dealing with it at the proper time. There's been some, I guess, some major setbacks with the United States not providing the aid internationally they have in the past, and so that's a major challenge that we have to confront in some way. Maybe there's a wake-up call that's happening now in our Congress, but we shall see. So congratulations to all the chiefs having made terms. We have sent to us, probably via Deborah Levine, the grant readiness session Thursday at so that those got the email, so try to send it out for network of people, because you never know who might benefit from this kind of grant. I don't know what, the extent of the dollar amount is, but there are those that even though a small sum can get off the ground. And then of course, Ryan Health, you can speak more on your private organization. Are there any other announcements? I know I send out from time to time over email different announcements. So it becomes a lot of email, but do your best to try to read them because there may very well be something of interest.
Can I just say it's even more important for us to acknowledge World AIDS Day because the federal government is.
That's in addition.
Funding significant.
And funding is, I thought it was totally, but well, you never know. Everything, the vaccines and all, yeah, significantly cut funding. And that's the message I was trying to get across. Also, yeah, maybe there's something we could think of doing. We need to, in conjunction with some of the other organizations, and come up with a resolution. And then we'll see what our congressperson end up with that.
And there's been in New York, yeah.
And Lakita, I just want to make sure that I will have.
One second, you may not be able to hear, but when someone was speaking, I'm sorry, it may be Heather.
Oh, no, so I was just stating that there's been an increase for the past couple of years. Diagnosed.
With new infections. And as a matter of fact, there's been new infections in terms of sexually transmitted diseases overall. We have mentioned that a number of times that there's an increase. And we've talked about, we've had presenters come in and mention it, and it bears mentioning again. So that needs to be our focus in one of our upcoming meetings again. And I'm sorry that, okay, so there was someone who was speaking just then, but I couldn't see who it was.
Hi, Lakita. That was me, Isaac.
Oh, okay, Isaac. Go now. You make your statement.
Oh, sure. I just wanted to make sure that I would have the opportunity to share a tiny bit about my organization. Not sure if that fits in the announcement section, but as part of the West Harlem Development Grant, we're required to present to this committee.
And Isaac, what is your organization?
Broadway Community.
Broadway Community is listed here. Under the HDC grantee. The agenda was sent out, but maybe, I don't know what happened, but you are definitely on the agenda. You are after Form Inc. So you're second, and then there's third. So you're on the agenda.
Perfect. Thank you, Lakita.
You're welcome. Okay, with no further ado, if there are no other announcements, we have a special presentation by Ryan Health. And I'm asking if you can presentation to 8 minutes or so and allow us questions. Be able to stay on, not get out of hand with our. Okay. And you're gonna, we have the background music of the trains overhead, and some voices are kind of soft. So we just need to make sure you speak up. And we have presenting today Charles Shorter. And Charles, maybe you will narrate this for us and introduce Dr. Lynch and so Charles Shorter.
Good afternoon, good evening, everyone. Thank you to the Community Board 9 Edwards Committee. There's Honorable Henry and Cameron and community members in the public. Ryan Health, we are a federally qualified health center years strong in the community, and with me, partners, Dr. Sharon Lynch, Chief Medical Officer. Ryan Health is one of the first health centers. It was established in 1967, and we're on the Upper West Side of 97th Street. Actually, at 100th Street, the Department of Health was our first site, and then we moved into. It was a demonstration project, and in 1977, we became an independent community-controlled health center. And we were renamed about Congress, and meaning community control 1% of community. Today, Ryan Health is a network of 13 health center sites across Manhattan, and we provide access to a high range, high quality service. I just want to make an announcement. Today, I was at a World AIDS, and the department has released their data for 20.
We could get that from our representative of the department. Thank you.
Our mission is building on a legacy of respect and service. We provide high quality, innovative, and responsive care to those in need. We emphasize underserved communities. We create safe spaces. Next one, whole band, we're out in it. We don't believe that you build it and they come, we have to. And our vision is to coordinate the definition of delivery of health services and make sure that they're equitable, high quality, and innovative establishment. We serve all patients. Health center, provided regardless of village, Medicaid, care, Medicare, and many private insurance. Those patients who don't have insurance, the uninsured. Also have a local. Federally qualified health centers, I explained, just sites movement, born out of the effect. We have health centers, 75 community health centers. In 1989, the term federally qualified creates. Dr. Lynch.
Hi, good evening. So, thank you again, Committee 49, for having us and presenting. We just wanted to tell you a little bit about ourselves, and also, why we're here is because we're opening a new location that's in Committee 49. So we want to make sure that everyone is aware, of the services that we're bringing to the community. And I just happen to be a resident of Committee 49. So I'm really excited to be here. So we serve 52,000 patients a year. We have about 200,000 visits a year. We serve patients, majority of our patients are low income, so about 88% of our patients are low income. 70% of our patients are enrolled in Medicaid or some form of government subsidized insurance. And then we have about 8% uninsured. And with the HRA 1 bill, that's looking like that may increase the number of uninsured patients. But as of right now, we have about 8%. 75% of our patients are people of color. So we definitely understand the need to provide culturally competent care to patients in a dignified, respectable way. We are serving about 9,000, or we were serving about 9,000 New Yorkers when they were coming to New York City. We have a location on 10th Avenue where a lot of the family shelters were placed. So we were doing a lot of care for some of the immigrants that were coming to New York City. We have sites right now from the Lower East Side to Washington Heights. So we have sites that span all of Manhattan, and then we're looking to open up our newest location on 135th Street, which we'll go over. But right now we have 7 primary care sites. We have 3 school-based health centers. We have community outreach. We have the mobile van. that Charles spoke and we showed the nice picture of. And we also have an emotional wellness center, which is where we see patients that may be in need of some mental health services. We have therapists and psychiatrists, and also primary care also is involved. So right now in Community Board 9, we have a health center, Thelma Dare, which is on 124th and Manhattan Avenue. Then we also have the mobile health center, which we go to multiple sites and locations. We are a designated primary care site, the mobile van is, so we're not just doing screenings, we're able to provide actual full service primary care on the mobile van. And then coming soon, we're gonna have a location, Ryan Health on 135th. The address is 520 West 135th between Broadway and Amsterdam. And it's gonna be a co-located space. But we're gonna be there serving the community. As of right now, we did a community needs assessment, and we're looking to see what needs the area the community needs. So some of the things that we talked about or saw is that chronic disease management, because there's a large part of the community that are diabetic, hypertensive. We need to look into pediatrics because of the pediatric obesity rates are increasing. And also some social drivers of health, looking at what it looks like to have food insecurity, how that may work into how we manage some of these chronic. So those are some of the needs that Ryan as a whole are addressing in all of our sites, but also will be addressing on 130.
Of course, you'll be also looking at chronic kidney disease, correct?
Absolutely, that's all about prevention.
Right.
Yes, that's about prevention. We want to make sure that we are able to prevent that, because that is a complication of some of those other chronic conditions that we're trying to look into.
You can have it up there, that's why I have to always.
Oh, we're gonna go into some of the other services that we're providing. So this here is just a very general schematic of what the health center will look like. The square footage is about 17,000 square feet. So it's gonna have a number of exam rooms. We're gonna also be bringing dental to the site. We're gonna have a pharmacy on site. So definitely looking to bring a lot of different support and medical needs to the next slide. So primary care services. So right now, for primary care, we'll be looking to do adult primary care, pediatrics, some women's health, prenatal care. We also want to bring HIV care, because like we were saying, it's World AIDS Day, and we want to make sure that we, make sure we discuss that we've had patients that have lost lives to the disease, but we are looking to make sure that we are able to treat this as a chronic condition. But really the key is prevention, right? Because we know that we're able to prevent it, so we want to make sure we're able to give PrEP to patients in order to prevent. So if you look on the right-hand side, PrEP and PEP, which is prevention of exposure and also post-exposure prevention, because that also is something that we're able to do. And we also need to communicate the community to let them know that these are things that are available. STI testing, you talked about the STI rates increasing, so that's definitely going to be something that we know is a need of the community. We also provide at some of our other sites that we have prenatal care. We do breast and chest feeding support because we know that that also is definitely important to the health of our youngest patients at Ryan. So we want to make sure that we provide that support for patients that want to breast and chest feed. And then we'll also be doing our cancer screenings, whether that be pap smears. We will not be performing mammograms. We will definitely be ordering them and ensuring that our patients get mammograms, and also our colorectal cancer screening. One of the other things that Ryan has is we have a healthy weight management program where we have board certified obesity medicine providers who are actually primary care providers. So it really worked well into our system, where we're able to incorporate not only medications, but also nutrition, lifestyle changes, things that patients that we can discuss and do in order to help patients get to a healthy. And it's weight management, not weight loss, because it's not always about weight loss, it's about being healthy. Some of the specialty services that we have on site at our other practices and some of the things that we'll be bringing to 135th, we'll definitely have dental at 135th. We have that at some of our other locations. Eye exams we have at some of our other locations. Nutrition, GI services, we have GI at some of our other locations. Geriatric services, so our patients who are 65 and older, we need to make sure that they are able to live healthy and independent for as long as they can. So we want to make sure that we intervene and make sure that we are providing the support that they need to do that. Also urology, we're also providing urology care at one of our locations or multiple locations, and then also podiatry. So we're also serving podiatry and some of the ancillary services that we provide, case management, some radiology services. We have x-rays and ultrasound at our location on 98.7. And then these are sorry.
What is your location on 135th?
Well, it's not open yet, but we're gonna be open 520 West 135th between Broadway and Amsterdam.
And where will you be?
Okay.
Oh, so long. Like, I was ready for you to be open tomorrow.
Yes.
For Q&A.
Yeah, and then these are just some of the other some of the other mental health services that we're providing. Depression screenings, therapy, medication management. And then these are some of the partnerships that we have throughout the community and the neighborhoods that we are in. I don't know if Charles want to point out any in particular, but these are just some of the partnerships that we have.
One is down at Riverside, which is in Manhattanville, the president of Manhattanville, we just did a huge event there. The bridge, we have a small bridge, work closely with Northern Manhattan, as well as the food and security summit. Again, it's about being out in the community.
Thank you, Doctor. You're not done yet, it's just like, again, going to.
I can cover this slide. This is our closing slide, actually. And what we're interested in anybody that is interested in becoming a board member. As I think Charles mentioned earlier, 51% of our board are patients. And so we welcome the opportunity members interested in dedicating some of their time to help us guide the work that we do in this community and throughout.
Excellent, excellent. So now we're gonna open it up for Q&A. Did you have a question,
Yes, I
sir?
do. Are there any data? Is there how many people got pollution wide that people get asthma on the 140? I understand there's a warning of treatment around there. I couldn't get an admin tactic. People have pollution, I mean the information and coma and 140. Okay, 140. I was wondering, does any
There is plenty data to show that.
I haven't found one.
Yeah, there's a lot of data that I don't have it in front of me, but there's a lot of data to show that pediatric asthma rates are increased in Black and brown communities. So if you look in like communities of color, the Bronx, Harlem, it all has to do with a lot of the ways that things were built or where certain highways were built. So there's a lot of information about the data that there's increased risk of asthma.
Give me the address there, I want to-
Okay.
And maybe we can steer you,
Department of Health, not
Really can also still react.
right. And as a matter of fact, that was a real boost to this fountain, working with asthma, that study. And with the buses and the amount of people who are off in the community. And especially since a number of depots in our west. So yeah, there's a source, and that's Dr. mentioned. And then we also have a connection with work Department of Health, mental health, in terms of their data. Maybe coming to the office, there's someone who might help.
It's only for the one coming.
Okay. Monique,
A question and a comment. First question, because I walked in and I apologize for being late. Charles was talking about FQHC. Is this gonna be designated?
We are.
This new location, right?
Yes.
yeah, Ryan,
All
Okay.
right.
a long time.
Well, I just wanted to make sure I heard that correctly.
Maybe about 15 years ago.
No, the 58,
Okay.
yeah. we are.
Yeah, you're one of them. I think there's a third one, there's Harlem Leagues.
Harlem United.
Harlem United.
Yeah,
Okay.
Harlem United.
And then just a comment, given the climate of what's happening around funding and such, I'm glad to see that another facility will be opened up in our CB. And we use all the resources that will become, or that's available. So I'm glad to hear this good news.
With the challenges in funding at the federal level, we need the support. That'll be very helpful.
Well, does that mean that you'll be needing a letter of support or a resolution?
We can come back to you on that in terms of some state policies that support of us. So when we see what the governor's budget looks like, we may back and ask for some letters of steer more money towards.
Oh, I'm sorry.
Okay, but. And what services are you?
So we have 3 school-based health centers. One of them is on the Lower East Side. We have another school-based health center within like Midtown, closer to our 10th Avenue location. And then we have another school-based health center around like
104.
103 and 104. And we provide primary care services, family planning there, if it's appropriate to the age group. So like on our Midtown location, that's a high school. So the services. Yeah, so we have a nurse practitioner and a nurse, so we give vaccinations, we do pediatric primary care. If there's a diabetic in the school, we hold the medications, if they need insulin, like we are very active participants of that school that we are located.
And is it during regular school hours or do you stay open?
So we can't operate outside of the school hours just because of the regulations of how our school-based health center works. So no, our school-based health center is open during school hours so that the children and the students are able to come and get care.
5 days a week or sure?
No, we're there 5 days a week. If the school is open, yeah, if the school is open, we're there. And then our schools also have social workers. So we have, oh no, we take them, absolutely. We had, if I tell you a funny story, if I have time,
Yes.
there was a snake. A snake as a class pet.
Okay.
And one of the children was bit by the snake. And the school-based health center nurse and nurse practitioner had to go and assist and help until, they were able to be seen. But so yes, we are available for emergencies. If things happen, they bring the child or the children down to the house. Yeah. And we also provide therapy. So we have a
Yes.
licensed clinical social worker that's there to provide mental health services and therapy.
Thank you.
I can't see if there are, maybe for,
COVID.
I just think they could be lowered. See if there's any, hands up there, yeah. Anyone's hands up? Okay, oh, thanks, Evan. Any other questions? Now at 520 West 135th, how many services will be eligible? And then, are there now? How many other,
So we're gonna be on the third floor and then gonna be on the first and second.
and it's 3 stories,
Three.
3.
Yeah.
That big building, okay, great. Okay. Excellent. And they've done it, yes, it's beautiful. Any other questions? You meant, let's see, on 10th Avenue, what streets?
Between 45th and 44th.
Okay. And then, of course, I know where Thelma Jerry is. I guess everyone else knows where Thelma.
Now I do.
Yeah, okay. Manhattan Avenue.
Everyone has.
Oh, Edwin's on.
Yeah.
Okay, and then, so there are 3 facilities in this district, or will be 3.
It will be 3.
Engineered before 9, right?
Yes.
Okay. Hi, Edwin, you're up.
Hi, thank you for the presentation. This is a much needed service. My question is regarding the duplication of services, given that we have, Columbia, we have Sinai. What is the differentiating factor that you bring into the community? Because one of the things that happens with a lot of our patients is that they go to this institution and they have Epic, right? They have all their information on one side. This decreases the risk of them, forgetting some of their medical history, their medication. How is this center different? And how are you in communication to make sure that this information is translated to the other providers that these patients go to?
Yeah, so that's a great question. So Ryan Health is a primary care facility, whereas some of the hospital-based organizations are usually specialty care. That's actually where we refer both of our patients for specialty care. So we share a lot of patients that go to Columbia, that go to Mount Sinai, to go to Northwell Health. And one of the ways that we're able to bridge being able to communicate and continue to have continuity of care is that we actually have our providers have access to these hospital systems through something called Epic CareLink Access. So I am able to actually go into Epic CareLink for Northwell Health, Sinai, for Columbia, for HHC, and see what's happening with my patients when they go to get their specialty care services. So we are not trying to remove patients from being seen at some of the facilities that you mentioned. We're actually looking to collaborate with them in whatever way that we can, because we provide primary care. We don't provide a lot of specialty care services.
Oh, okay, thank you, because I thought that you mentioned that you were gonna have nephrologists.
No, we have a urologist, but when I say we have specialty, we only have it for a minimal amount of time. And we usually do that, like we'll have urology maybe 1 session a week. And we do that for our patients that may not feel as comfortable navigating a hospital system or going outside of our system. So it's easier for us to control that environment. So some of our patients that don't go to the specialist because, they get lost, they can't get an appointment. We like to have some specialty services on site that we know our patients need, just for those patients that might have some difficulty and challenges navigating a larger hospital.
But, let me just add this, because I deal with the population. Finding, medical, appointments anywhere in the community, a lot of my clients live here in MCB9, even though I work in the Bronx, is, generally a 6-month wait list, 4 months wait list, 5 months, so you're not really duplicating. The fact is, Columbia's wait list now for neurologists is 9 months. So, to have you in the community, is a blessing, because I have clients that have diabetes, they have heart disease, and when we can refer them to someone in the community, have to, us, blessing. So thank you for being.
That is a good
You're
point.
very
You're right. I get frustrated. I mean,
Look,
I
that's
know,
not a duplication of
no, I know.
service.
I know
Well,
how to not.
Monica, that is an issue that you have in the healthcare system. Even small clinics that bring specialists in with time, they also have the backlog. I think it's not unique to our institution. It's basically a nationwide issue.
I have,
Set of
Edwin, did you finish your point?
Yes, yeah, I finished my point, but thank you. You guys are bringing a great service.
Yeah,
as
yes,
far as the school therapy for young people, I was wondering, do you follow up with the family as well as a whole unit? Often I see young people that are treated, but the home base is not, and that still remains a problem.
Yeah, so we are, when we're in the school, we have to get consent, to provide, treatment to, patients, but you are absolutely right. It needs to be, sometimes the parents need to come into to the therapy session, or separate meetings
Right.
with the parent have to be, done, but yes, all of these things are just based on whatever the best circumstance is for the child. Just to make sure that they have a willing parent, guardian, participant in their care. Unfortunately, that is not always, and parents, guardians are not brought in because of all different types of reasons, but for when it is safe and healthy for the patient, yes.
I think my, question is kind of that's on, the other hospitals. You actually have a relationship contract with, say, Mount Sinai, Columbia,
Yeah.
Okay, Harlem.
So we have a collaboration agreement with HHC, with Northwell Health, with Mount Sinai, so we refer to them, and we refer our patients there for specialty care, and then have access to their EMR system. So just as Mr. Torres has mentioned on the Zoom, so that we're able to see what's happening outside of our four walls and bringing all that together. Because as a primary care provider, we need to be in control and managing all that's happening at the other facilities. So yeah, we have collaborating agreement.
And Harlem Hospital, just curious.
Yeah, HCC Metropolitan Harlem. So I just had a phone call with the CMO at Harlem because I'm letting them know we're coming into the neighborhood. We're looking for obstetrics capacity. So if they're able to deliver, if we're gonna have prenatal care, we have to be able to deliver at a hospital. So I've been on the phone with CMOs at some of the other hospitals and just making sure that they know that we're coming and that we're gonna need some specialty care access. So we have the meetings coming up to coordinate all that care. So when we get here, we'll have a relationship with them.
What about doulas?
We don't have doulas, but doulas are now, Medicaid does pay for doula services. So we have partnerships with doula services. We don't provide doula services on site.
Okay, and my last question, what about undocumented, patient or, users? Can you accommodate?
Oh, absolutely. We do not ask for immigration. That is not anything that we ask any of our patients. We are providing healthcare as a right, not a privilege. So the ability to pay, we have sliding fee scales, but immigration status is not a question.
Thank you so much. I want to thank you again for coming back. This is your second time in a row, but you can come to every committee meeting. We welcome. We don't want you to be just a one-time drop.
Oh, absolutely. I'm always happy to come back and share how things are going and hear what you need from the community or what you're hearing from the community member.
Okay.
We brought some annual reports over there, if anyone wants to.
Oh, okay, yes, we'll keep them here, any remaining ones at our office, at this location.
And if there's people who might be interested in being on the board, what should we?
Oh, yeah.
I can give you my.
I think that.
Yeah, cool. I'm a big supporter of the Ryan Health System.
Good.
I used to do work with the ambulatory pediatric clinics.
Oh, wow.
Our read program.
Oh,
Wonderful.
I agree.
Thank you so much.
Thank you.
So, moving right ahead, so, I think we're doing pretty well. I believe I saw, moving on to our WHDC grantees that I saw, Christina Perry, I'm not sure if anyone else from We All Really Matters on Zoom or not. But you're up. Christina?
Hi, Lakita. How are you?
I'm doing good, thank you. Happy
Hi.
Thanksgiving season.
Happy Thanksgiving to you too, and to everyone on the platform and on site at MCB9. It's an honor to be here and speak for WARM. So my name is Christina Perry. I'm the Director of Operations for WARM Inc., which stands for We All Really Matter. It's a domestic violence organization based out of Harlem. We're located on 126th Street between 5th and Lenox. And we have our main office.
I apologize for interrupting you. Do you need to show any diagrams or anything like that?
No, I do not.
Okay, Isaac, do you?
I have a PowerPoint prepared.
Okay, so I'll just get it set up. Okay, Christina, thank you. Go right ahead.
You're welcome. Okay,
Christina.
so we're based in Harlem on 126th Street between 5th and Lenox, and our headquarters is in the WeWork building. What WARM does for the community, it's a domestic violence organization where we're a resource center, and we are partnered with the NYPD and the district attorney's office, the city council's office. But what we do so amazingly, I would say, is our critical response team. And it's where the NYPD contacts us in 24 hours a day, where a woman, a child is in danger, whether it's in Harlem Hospital or in their home, and they contact our hotline, and we respond on site. We have 2 Sprinter vans. We report to the residents or to the hospital, and we rescue the family and we bring them in to our office, where we would supply them with clothing, personal essentials, and place them in a hotel for up to 3 days until we can find them permanent shelter space. And it's one of the greatest things that WARM has been able to do with the NYPD, and we've been doing it for five. I've been there for almost 6 years, and it's been an amazing thing. We have over 800 clients on our caseload. 90% are minority women. We are increasing our men. Like we've had since the summer, we have seen 25 single males coming in, and it's it's heartbreaking because what we struggle with in New York City is single place residencies. So families, we have shelters for women and children. We have shelters for families. We can get them right in. And what we do is we kind of we're gifted with partnerships to be able to bypass the DHS PATH system, right? We can get the women and children straight into the shelter, you know, and but the single women and the single men, all we have is the drop-in centers. It's either Franklin Avenue in the Bronx or in Brooklyn or Bellevue Men's Shelter. And you know, and we're not the only ones affected by it. A lot of DV organizations, a lot of DHS organizations are affected by it, and it's a change that, you know, has to be made in the city. But you know, other than that, Warm has made 15 years this year, and we opened up the first holistic center in Harlem. We have a space opening up. It should be opening up in March. I don't want to speak out of turn. I'm checking with Stephanie again, but it should be March 2026. But we already started our services. We have yoga, meditation, cranial sacral therapy, somatic experiences, internal family systems, acupuncture, massage, and EMDR. And it is an amazing thing for the clients. You know, other than the support groups that we have, the women get to come in and start to do that inner work, that inner healing that's needed, you know, on their lives. And we have therapists on site. What we do out of the Warm headquarters, we provide 4 of the holistic services. The other 4 are done offsite. And it's all free of charge. You know, we have a licensed clinical social worker that runs the holistic center. We have an appointment scheduler that books the clients. And, you know, again, it's all free. They're 1-hour sessions. I've done them all and they are amazing. You know, these therapists are truly, they're truly amazing. What they're offering, you know, to our clients, and for free, you know, but yes, so Warm, and, you know, in summary, Warm is more than just placing women and children into shelters. We sit down with them, we do their HRA applications, you know, their NYCHA applications, one-shot deals, emergency, you know, relocations out of one apartment to another. And we pride ourselves through partnerships. You know, Stephanie McGraw, our founder, has been doing this work for 15 years, and she has made some amazing connections out in the community. And we're like so blessed to be able to like pick up the phone and call the commanding officer of this certain precinct, or, you know, we can call the Mock J office, and, you know, really get to talk to the people that can really make change for our clients that are in need, like in demand and the moment in real time. So, you know, I'm honored, I'm grateful to be part of such a great organization that's growing and doing so much work in the Harlem community. So I think I covered a lot, but I can answer any questions you want.
Thanks, Christina. Let's do Q&A then. So thank you so much. That was pretty thorough. Monique?
Yeah, so I'm sorry, are they opening up a new location? That is that?
She's opening up new locations, like in March, planning.
We're shooting, the last time I heard, it was gonna be March 2026, and it's gonna be on 131 and 7th Avenue.
Okay.
So not in District 9, but do you know approximately how many of your users are from this area? I know it, you know, for security reasons, you don't have to stay in these. You know how many
Yes.
battered women and men who may be coming?
In the CB9 area, 68%.
Oh, wow. Okay.
Mm-hmm. Yes.
And how do they find out about you? Word of mouth?
Well, we have a community outreach team. We have 2 gentlemen that work on the team, and we partner with NYPD and do wellness calls with them. We do street outreach with NYPD. We do our own. You know, we hit the hospitals, the barbershops, the nail salons, because that's, you know, that's where it's at. You know, we put our literature up, clinics, local clinics, and we do a lot of events. We do a lot of in-house events. We do our seasonal Love on the Block events out in Harlem and also in Brooklyn and the Bronx. So we're all over and we are, we do a lot of Instagram, we do a lot of promotion, we have a social media tech on site that's really getting the word out.
All right, because they don't want, to be trailed or.
Right. We
Yeah.
don't disclose our address, we try to keep that as much, as close as possible. But we say who we are and what we do, and we are available 24/7.
Any other questions? That was pretty thorough. I know last year you had the gentleman come with you, and I believe he was extremely valuable. You said talking to some of the men who have been abused coming. Are the men who abuse, just curious, abused by other men or just in an abusive husband-wife situation?
I would say when I gave you that number of 25 since the summer, I would say out of that 25, 20 of them were same-sex partners. And the other 5, like 5 of them were abused by their wives or girlfriends.
Wow.
And it takes great courage for these men to come in, and nothing, male, woman, domestic violence is, it's violence and it doesn't matter.
Can you just cite the statistics on female on male abuse for the people here?
Ooh, I'm sorry. I'm just getting back from Atlanta today, so I'm still on vacation. I hope I have that information on me. But I know it's for us we have 891 clients and 115 are men. So that's our numbers. And that's since 2020, those numbers. So, and it increased with the men since 2024.
I understand Monica was saying she believed it was higher. Yeah, that's an interesting subject, very interesting. Because, ostensibly just hearing it, you think the other way, just because it's what's in the news more.
Those are worse.
Which one is worse, female on male?
Yeah.
Oh, female.
Wow.
That's interesting.
Yeah.
It's generally much more like very violent.
Mm-hmm.
That's it. Well, much success, congratulations to the all. Oh, Heather.
Does your program also cover verbal abuse, or is it all physical?
I really
Did you
didn't hear.
Christina?
I didn't hear, no.
Cover verbal abuse, or is it all physical?
It's all abuse, verbal, mental, financial, physical, psychological, yes.
Thank you.
Well, the stat is 1 in 7 men.
It's 1 in 7.
Victims of severe physical and mental partner violences.
Mm-hmm.
Wow.
Yeah.
Those are non-verbal.
Thank you, Christina. Thank you for getting back in at a nice period of time where we can now. Okay.
You're welcome. Thank you.
Hold on, there is a question, but Candace.
Your clients, are they going to able to go to another shelter if it's in Alabama, like a Red Cross or organization that might have for place where they can take, or they're going to rebuild shelter?
He's asking about shelter use, but I believe that Christina was also saying that they keep that pretty, see if they can bypass the regular, shelter system.
Yeah, I say that because my friend kid out there, and having problem with one shelter organization is a friend of my friend. Also. So, there's no other understanding. People going through their crisis because it doesn't make them that right information.
Can, offline, can this gentleman give you a call, Christina, for, is there a number he can call?
Yeah, man.
Absolutely,
Go
yes.
further.
Yes.
Do you mind, can you take down the number and then he does, okay. Will you let us know if you change? Because there's a lot of privacy involved with that or.
Right, but that, what he's talking about is the general, shelters. Not talking about particularly.
Okay. Yeah, so hold that one because we will be. Find
So
someone.
they
to talk
give
to.
it not even for everything.
Okay. Thank you again, and, hang in with us if you want to stay longer, you're welcome. Okay, and now Broadway Community with Isaac Adlerstein. Isaac, no more than 8 minutes.
Yes, ma'am.
If you can make it even a little shorter, that would be, sure, we should do okay.
Yeah, I'll do my very, very best.
Mhm.
Thank you all so much for having me. Are you able to see my screen?
Yes, but here,
Oh,
okay,
yes.
there it is.
Okay, terrific. Okay, so I am
Oh, hold on, Isaac. Anthony, will you be needing, to be made a co-host?
I will be making a presentation with the PowerPoint, yes.
Okay, all right, go ahead, Isaac. Sorry for that interruption.
no worries at all. Hi, everyone. I'm presenting on behalf of Broadway Community. We are a 43-year-old human service agency on 114th and Broadway, so the southern tip of the community board. And our mission is to serve as a bridge from crisis to stability for our neighbors experiencing homelessness, hunger, and social isolation. We play a very unique role, I think, in our neighborhood's homeless service infrastructure, and I'll share more about that in a moment. But before I hop into it, I just want to go over our core beliefs as an organization. I think that they really belong in 3 pillars. The first of which is that access to food, shelter, and care is a human right and not a privilege. We don't believe that anyone should have to beg for food, a safe place to stay, or basic medical care in this community. Um, the second pillar is that community is both the means and the end. We believe that healing happens when people are in relationship with one another. And as a result, we don't have transactional relationships with the people we serve. We actually accompany them on their journeys with homelessness. And I'll share more about that in just a moment. And then the last pillar of our belief system is that no one is beyond hope and that no one should be counted out. We've seen far too many success stories to believe otherwise, but people can grow, they can heal, they can begin again, no matter how many times they've struggled or how many systems have failed them. We truly believe that, and that is at the center of what we do. So we run what I like to refer to as a one-stop shop, wherein we have a number of services under one roof that holistically meet our neighbors' immediate needs and their long-term needs. And this is really in response to the fact that the homeless service system is so broken because people are consistently referred to other service locations. And asking someone who's in crisis, who may not have the ability to purchase a MetroCard or to navigate the transit system, asking them to go to multiple locations for food, for medical care, for benefits, for shelter is very, very difficult, and it creates unnecessary barriers to recovery. So what we do is have everything under one roof. And I like to, again, group everything into three buckets: immediate needs and dignity, physical and mental health, and then pathways to stability. So I'll go into all of those briefly, and then I'll take some questions. So our programs, we have a soup kitchen, a shelter, on-site medical services, showers, a food pantry, workforce development, case management, and support groups. And I'll speak about all of these. So our soup kitchen is open every Monday, Tuesday, Wednesday, and Friday and serves between 200 and 300 people. We provide both breakfast and lunch, and each lunch is thoughtfully prepared by our fantastic chef, Chef Tim. We have the reputation of being the so-called four-star soup kitchen. And we're very, very proud of that. We're hoping that we could add that fifth star at some point. Most of the people that dine with us are experiencing homelessness, hunger, or social isolation. Sorry, I'm just going to reshare my screen. Sorry about that. Oof. Sorry. Okay. We also have a dignity program wherein we help our guests access critical hygiene, such as showers and laundry. We're one of the few locations in New York City that provides either of these services. Each day, we provide showers to about 30 people, and we do laundry for our neighbors that are living on the streets. Shelter, we have a program 7 nights a week, 365 nights a year for 19 single adult men and women. We are based in the Broadway Presbyterian Church, in the basement of the church, and as such are just one of two of these so-called house of worship-based shelters in New York City. I hope that number could go up much more in the years to come. But as it stands, we're just one of two of all the shelters that are based in houses of worship in the entire city. Um, Healthcare. We work with the Institute for Family Health to provide primary care and preventative medicine to our neighbors experiencing homelessness. The Institute for Family Health sees people regardless of their insurance status, and about 300 people receive primary care from our clinic each year. We're also partnered with Connected Care with the United Way for New York City's Connected Care program, wherein we have preventative health education seminars and have separate health screening events through the month. Our food pantry serves 120 families every Thursday, and we have a very strong emphasis on distributing fresh produce and lean proteins. Those are unfortunately things that are difficult to come by in the emergency food system as a whole. So it's really, really vital for us that we give people healthy options. We have a workforce development program wherein we help our guests create resumes, write cover letters, prepare for interviews, and apply for work or training opportunities. We've helped dozens of people find employment in the last 2 years, and many of those people, as a result, do not depend as much on the other emergency services that we offer at Broadway. And we also provide internet access to our guests who otherwise wouldn't be able to stay connected with friends and family and with the outside world. We have a life skills program that we successfully ran in 2023 and that we're going to be relaunching again at the beginning of this coming year. And the program has three core pillars. The first being the development of life skills by bringing in guest speakers to talk about areas of their expertise, such as personal finance and self-care and stress management and healthy relationships. The second pillar of the program is partnership and goal setting, wherein we have our guests work with a dedicated volunteer through the program and set a series of goals for themselves and hopefully achieve those goals during the program and long after, while of course maintaining that supportive relationship with the program participant. And then lastly is the sharing of personal stories. We empower all of our guests, if they so choose, to share what they have journeyed with in their life. And they could do that either under their real name or under a pseudonym. And we have a couple stories published on our website. that show great resilience and tenacity when overcoming homelessness. Couple other programs I want to mention. We have a program called Community Table, which is a outstanding banquet that we prepare once a quarter. And our chef makes a 5-course meal. We have a group perform music from Juilliard. We have volunteers serve as waiters and waitresses. And it's really an opportunity for people across all socioeconomic levels in our community to join together in a shared meal and see that we're not so different. You may be housed, you may be unhoused. It doesn't matter. We are all members of the same family. We offer case management, wherein we help our guests obtain Medicaid or obtain identification and benefits and all the things that they need to get back on their feet. We also have access to the Coordinated Assessment and Placement System, also known as CAPS, with the Department of Homeless Services, wherein we're able to help our guests submit applications for supportive housing. We've helped about 24 people enter permanent housing in the last year and a half, and we're very, very proud of that. Many of those people were chronically on the streets and in shelters in our community and now have a place to call their own. And then lastly, we have support groups and supportive counseling. And our support groups take place each day after our soup kitchen. And they include a mental health peer support group on Mondays, a faith and spirituality group on Wednesdays that allows people to share their life experiences through the lens of faith, regardless of their religious background. It's an interfaith group. And then a healing arts group on Fridays. And then we have a social worker on staff who is able to meet with people on a one-on-one basis and perform so-called supportive counseling. So that's what we do at Broadway. You can learn more by going to our website at broadwaycommunity.org. My great hope for the next couple years is that our one-stop shop model could be replicated across the city. We have something that is very, very effective, and there are many of buildings in the city, particularly houses of worship, that are underutilized in the daytime, and that can provide some, if not all, of the same services that we do. And Lord knows we need much more of all of this. So if there are any places in CB9 that any of the board members or any of the community members listening in are connected with that are eager to engage in this kind of work, please don't hesitate to get in touch with me. I would be very, very excited to discuss all the possibilities. So thanks again.
Thank you so much, Isaac, for that presentation. There's a lot of information. You're doing great work, and the facility is really lovely. You know, where
Thank
they
you.
dine and all. Very nice.
Thank
Are
you.
there any questions? I know that you has a question. Heather, yeah, hold on, Isaac.
What is the wait list for a bid? One of the most. Did you hear me? What is the wait list? For
I
a
think-
bed, I think you mentioned you only have 19 beds.
Yes, thank you. Thank you for asking that question. So we work with people on a referral basis for our shelter, and we're looped in with the city's 311 system. So all of our people come either through there or directly through our soup kitchen. So if someone is in need of shelter and does not want to go to 30th Street or go to Franklin Women's Shelter or the Help USA shelter in Brooklyn for intake, they're more than welcome to come to our soup kitchen. And if we have a vacancy, we will offer them a space. And I would say that on a weekly basis, we have a turnover of 1 or 2 beds. But what is really core to our shelter's work is that we, again, journey with people on their journey with homelessness, to use that word again. People could stay with us 7 nights a week, 365 nights a year, barring them breaking the code of conduct or missing 3 nights in a row. But we'll work very closely with them to get permanent housing.
At one point, you indicated that you had a number of people who were living in their cars. they had a place to come and eat. Is that
Yes.
still heavily, or do you know how many have found shelter since then, even if it's, very limited space?
Yeah, I
Those
mean,
not among the 19.
yeah, especially this time of year, there are many more people that are wanting to come inside from their vehicles if they are sleeping in one. I don't have a precise number on how many people have entered into shelters as opposed to their vehicles, but there is one person in mind who we did bring in this summer when we had that horrific heat wave in the 100+ territory. And he stayed with us for a number of months, made great progress on his housing, and is now at a so-called safe haven, which is the final step typically before a person enters into an apartment of their own.
And we have two more questions, Lena and then Monica.
Given that you're in the church, I was just wondering if there's any religiousness associated with the services you provide, or is it non-religious, given that, and if that's an issue?
Yeah, that's a great question. Thank you for asking that. So we are a separate 501(c)(3). We do, of course, work closely with the church, given that we're in the same building. We particularly coordinate on maintenance and security. But we are a secular organization. That said, we do employ a board certified chaplain who is able to address the spiritual needs of our guest community. And the reason we moved to hire a chaplain is because homelessness is one of the most spiritually isolating experiences that a person could have. A person could really question what importance their existence has and where what purpose their lives may have. So to have someone that speaks that language of faith is very, very important. And if hospitals do that, and if universities do that, and police and fire department have chaplains, we figure that the homeless service system should as well. So as it stands, I believe Brian, the person that works as our chaplain, is the only chaplain in the entire homeless service system in New York City. And I hope that that could change based on our example. But we are a secular organization, to reiterate.
Thank you.
Monica?
Oh, ideally, how much more space do you need for beds?
How much more space do we need for beds?
Yeah.
I would say the demand is always exceeding the supply that we have. There used to be, before COVID, a program called the Emergency Shelter Network, which had about 800 beds in houses of worship that provide a meaningful alternative to the municipal shelter system. And unfortunately, during COVID, that emergency shelter network closed. So as it stands, we're currently just one of two of these shelters in a house of worship, and demand is always exceeding the supply. So I would say, in my ideal world, I would love to get 100 beds in settings like what we have here at Broadway Community. And they're really conducive, I think, to getting people off the street. Most of the people I will say that are on the street have been in the shelter system before and choose to be on the street because they feel so deeply unsafe in the shelter system. So to give them a meaningful alternative where they could really feel safe and be in community with one another is very, very important. So to that, I'll say if there are, let's say, five
To
houses.
wrap up, Isaac.
Yeah. If there are 5 houses of worship in CB9 that are interested in creating shelters but aren't quite sure how, I would definitely invite the opportunity to speak with them and to brainstorm together.
That's
Great
terrific.
idea.
That's a great,
That's a great
yeah,
idea.
that's terrific. So we need to find, I'll make notation, to follow up on that.
Work across different church.
Mhm.
Yeah, I mean, that's
There's an
it.
interfaith council, we need to work with them and all the ministers.
Yeah, absolutely. I was thinking about that. And that space is available.
Interesting.
Let's start a movement together. Let's take this beyond.
Absolutely, that's basically what we're saying. Sounds great. So we'll be back in touch, and then I'm gonna call Monica Dula, who just spoke, who's very resourceful, see how we can make connection with those groups. At least have a session, see where the interest might be.
Outstanding. And I
Thank you.
will put contact info in the chat.
Thank you so much. You're gonna put your information in the chat, you said?
Yep, just put it in.
Okay. And those of you who do not have access to this chat, then I can send it out on follow-up email. Thank you again.
Thank you, Lakita.
Okay. Michael, we have to be done with Q&A and everything else at 8 o'clock, but I think we can do it. So you're on. Anthony Michael with Association for Learning and Mentoring Services, nicknamed ALMS.
Hello, everyone. I'm going to try to be as quick as possible. As you can see, we're almost entirely a volunteer organization. We combine intergenerational volunteer services between college students and seniors. We create unique projects that we can engage seniors and combat loneliness. A brief introduction to our organization. We're entirely a volunteer-based organization, as we just said. We serve New York City, Rockland County, and New Jersey areas. We're going to be turning 5 years in this February. We've won the following grants: Community Care Corps, which comes out of the Department of Health and Human Services, the New York State Department of Agriculture, which helped us create 2 food pantries that help us deliver fresh fruits and vegetables from socially disadvantaged farmers in New York. We recently won a New York State Department of Environmental Conservation grant for a refrigerated van that now will give us the ability to distribute food throughout New York. We are 2-time recipients of the West Harlem Development Corporation grant. And this June, we were a recipient of the AmeriCorps Senior RSVP grant. Both Rutgers and NYU are working with us to see if they can engage more of their students in most of our programs. Some of the collaborators that work with us, obviously, is the NYPD, Catch, Morningside Retirement Community, Columbia Community Services. Just a brief background of what we are addressing is primarily senior loneliness. And as you can see from the stats, it's pretty prevalent. And the bottom bullet point, as you can see, 61% of senior-led households in New York City are rent burdened and experience a tremendous amount of depression, loneliness, and cognitive decline, which also leads to a lot of other health issues for seniors. We started in West Harlem in 2023. We were working with the NYPD and then Columbia, who are pointing us to certain locations that need our services. We engaged Morningside Retirement Health Services as the first people that were outside the NYPD. I just put in this first bullet point as one of the first trips that we gathered a lot of the seniors to. We let them pick which ones they want to go to. They picked the Princeton, New Jersey Hindu Temple. The second one went to Peddler's Village in Pennsylvania. Another one went to Foxwoods. They're becoming more and more creative. Later I'll show you some combined pictures where we're actually combining seniors from different locations and going on trips together. That forms a lot of new friendships that we have experienced. We do provide monthly gatherings within certain locations: Morningside Heights, Catch. We sometimes come up with other locations and some other pop-up events when we work with the NYPD. Some of our grants have the tech training feature, which allowed us to even distribute iPads and have seniors connected to some social apps. And then we've expanded to Catch, as I mentioned, but we've now recently formed a partnership with the Antioch Baptist Church, and we're trying to form additional partnerships. From the Community Care Corps grant, as you can see, we have a lot of programs that have come out of it. We are relaunching the College Adopt a Senior program probably in the spring with more Rutgers students and NYU students. We do have a lot of events. We've recently just finished our Thanksgiving event out of the Antioch Baptist Church. We're trying to do a holiday luncheon with the NYPD in Columbia. The location's still pending. We're trying to see if we can secure a location at Columbia University. We do deliver food into West Harlem. We do it through the NYPD. And due to what I found out just recently, that NYPD doesn't have certain resources like a freezer or fridge, through the AmeriCorps grant, we just shipped them a brand new freezer out of the 26th precinct, which now gives us the ability to drop off food at that particular location so they can be able to have that functionality. Um, the AmeriCorps grant basically expands on the Community Care Corps grant that we have. The issues with the AmeriCorps grant right now requires us to obtain 530 volunteers in New York and New Jersey. It's a 3-year grant. The first year requires us to have all 530 registered. And we've added West Harlem into the grant after the grant was issued. The problem with West Harlem's issue on the original grant application is, as most of you know, the median household income in New York County is pretty high. So we were a little hesitant of adding them originally into the grant. After the grant was issued, we came back to make an amendment, and they allowed us to have that amendment and include the West Harlem location into AmeriCorps. The added other issues for AmeriCorps is that our seniors have to be actively involved. They define seniors as 55 and over. It also adds a mental health feature, which allows some of our volunteers to be trained under mental health first aid courses, which we pay for each volunteer that is interested in getting that certification. It allows us to deliver food into senior houses as well as NYPD special events. And I'll just skip that. These are a couple of photos from the recent event from Thanksgiving. We had one in Logan Gardens as well. Some of them didn't want to leave out of their area, so we brought the Thanksgiving dinner to them. And then this is basically previous events that we've had throughout. This one's on to St. John the Divine, where we had most of our college kids come in and host the seniors, and we worked with the NYPD in this one. And I think this was last year's event. And this is one of the events that we had in one of the trips that we sent the seniors. This one was a combined event where we brought in Catch and Morningside Heights, and we went to one trip with them together, and a lot of friendships were formed, which was pretty unique to have them interact with each other. Another thing that we do get from time to time is we do get a lot of in-kind donations from L'Oreal, Costco, other vendors. Those are distributed to seniors at local events as well as to the sites that we serve. And currently, we are looking for additional West Harlem partners so we can help build up the network and help with the AmeriCorps grant and help it grow a lot further. These are other programs that we do outside of the senior program. We do work with NYPD for the backpack event. We do sponsor the Together in Harlem event as well. I will now, okay, I'll just do this one more slide. We do have another upcoming trip for seniors. This one is to Hunterdon Hills for the Christmas at the Playhouse. We are working with the West Harlem Development Corporation and NYPD for the holiday luncheon. I'll notify all of you once the venue is set. And that's it. I'll leave it to questions.
Thank you, Anthony. You guys are doing a lot. From what I can gather, you are hosting a number of events to reach seniors and to be helpful in whatever way and provide them with certain needs, like from L'Oreal, some of the other companies. That's what I'm getting is this event, setting them up or signing them other programs.
Yeah, we do.
Additional help.
We do have webinars and iPad distributions and technology training. We do assist in the food distributions, but not all the time because we don't have a physical food pantry in West Harlem. Our expansion with respect to the food distribution will expand after we close on the New York State contract with the refrigerated van.
So let me,
Go ahead.
oh, okay, so, because I don't want you to have to repeat that, I was just trying to get the gist of it. I think you're different, and provide a needed service and, you know, in a unique way. So I'm wondering, are you in touch with other senior citizens or older adult centers? That may provide a connection. I know you mentioned some of the other groups. I didn't hear senior citizens groups so much, but where you have enlisted students like Rutgers, NYU to help in serving Thanksgiving dinners, that kind of thing. How do you keep up with your seniors? Do you have a list or emails?
Yeah, we have a list. We have an email distribution list. We do work with Ron Bruno at the Morningside Heights Retirement Center, Tedesic Lewis at a Catch, police officer Ann Cardenas at a
You
26.
work with the New York City Department of the Aging to get additional list of older adult centers?
I have not reached out to the New York City Department of Aging.
Yeah, they would have a list of just about all of them, if not all of them. There are some that have had a funding issue so that they may not be in existence. Just look on, I think if you just look on the website, Department of Aging Centers for Older Adults, I think that's the name they are really using more than senior center. Although some.
J.K. Robinson, was, Country Mountain Company, 125th.
Okay.
I haven't this year, they rebuilt it.
Okay. So there are bottom line is there are a number of older adult centers, and through that, you can build a network where you can provide services that they are having, you know, that they may not be able to buy. And and the other thing is, you said the income in this district, District 9, was too high, you had to modify it down to what? What's the?
So when we applied for the AmeriCorps grant, they went by county. They didn't go by the specific district within West Harlem. So if I would submit the grant application and include West Harlem, it would not help us in that.
What's the income level that they wanted, that they accepted?
They didn't say they'd accept anything. It was just based on the way we were applying for other counties. It was higher. The median income in New York County was, I think, over $100,000, and District 9 was substantially lower.
Okay, so they went with this because it was substantially.
Yeah, the way these grants work, unfortunately, is sometimes they have a screener that just looks at the specific county, and then they'll just bounce you if they thought it was too high.
Okay, and there was one other question. I have to look at my notes here. We'll come back to it.
So he's trying to reaching out to, but they're trying to grow the program, correct, to reach more seniors?
Yeah, I'm trying to reach more seniors and try to see if we can get programs, especially with the RSVP program, like if we can get senior volunteers who are 55 and over who can actually help us participate in the location. AmeriCorps allows us to fund programs in West Harlem if we have senior volunteers. Go ahead.
Anthony, I think that's the way to go. The list, and they may even provide you telephone numbers and the names of the executive director. That's the New York City Department of Aging.
Okay.
That's the national. They have a list by name for all the agencies. So we're concerned with our district, so you know the street,
right,
orders, and just go for it that way. We also have a senior. Actually, they're called. Well, I guess they do say no. They say older adult. I know Walter Alexander is a co-chair. And I think that they changed the name to Older Adult Committee, something like that. They may not have, but you should call the district office and ask to have a presentation with his organization, because they should also have a list of the seniors in our district. The senior action, well, yeah, senior, maybe they're not called older adults, senior action committees. And even though it's, people, they like to do things, and also, the regional person is William Hamer. He is the executive director of, and I can't recall the name of his organization, but I can email it to you, William Hamer.
Yeah, I think we
They
had.
do theater. I mean, these are seniors who are on the ball. They like to do things, go places.
Right.
And they will recommend others if they personally feel that they should not take, that what's available to give. They can find others who are really in need, and they have some of them would volunteer. So Walter Alexander would be a contact, as well as just here in our district office, the district manager. May even be able to help you.
West Harlem Older Adult Alliance. Okay, so.
Is that
When I
because of
looked up
William
William
Hamer's?
Hamer, this came up.
Okay, so yes, what's the name of it again?
West Harlem Older Adult Alliance. WH.
The Older Adult Alliance. He would be a terrific contact. You may have to keep calling him to let him know what you're doing. You have his phone number there?
I know.
But you got that West Harlem Older Adult Alliance, okay?
Okay.
Any other questions while we're on this? Congratulations again, Anthony, on the grant. And just, be in touch, and if you haven't heard from me, just shoot me another email, but I'll get
Wait, I just found William Hamer is also, in addition to being this guy, he's also Harlem Advocates for Seniors. That's another one, HAS.
Harlem Advocates for Seniors.
Anthony, will you put your contact information?
Sure.
And put personal phone number.
I don't see it, but I can find it.
Oh, that's right, you're not online, can you
I am.
go on the Zoom?
I am on Zoom.
Okay, so if you maybe copy and paste and stick it in the chat, and then Anthony can pick it up from there. Okay, Anthony, thank you so much. Okay,
Thank you.
Love to see you again.
Same here. Thank you.
I just put that in.
Just put it in the chat for you. I'm gonna go, these next 4 items under old business can go very quickly. I just want to thank the committee. We really had really good help in putting together the district needs statement. We met, I think it was, there was an early deadline, and I believe there were 4 of us on the call that evening. I believe Liz was on the call. I'm not sure. Heather was on the call. Monique was on. I was on. Oh, and no, I don't think he was on that call. And Janera Ramirez. And so there were 4 of us. And following, but Cameron put in the suggestions, and when he copied the district needs statement for us to review. And we made quite a few suggestions. And so I think it went very well. And so we'll see how it all goes, and then we'll see what will get funded. And of course, it's going to take a little while, especially with the change of administration, what priorities will be. But we'll see. I'm glad to know that an additional healthcare center is coming to our area, full service, because that was one of the things we put in our district needs statement. So in a way, that can be fulfilled as long as all is approved. We don't necessarily know about Brian, but we did state that it was needed. But I'm sure there's another aspect as well, especially when we deal with some of the chronic diseases that are happening in our community. There's probably a need for several other matters, healthcare matters that can be handled better owner. So I just want to say thank you to this committee on that. In 30 seconds, Cameron, are you up to just reminding us of the December 6th event? I don't know if he's still. Name is there.
Yeah, for sure. So I just put it in the chat.
We don't have the access to the chat so much here, so can you tell us just?
For sure. Just Harlem Legionnaires Task Force is going to be having a town hall meeting on December 6th from 3 to 5 p.m. at A. Philip Randolph Senior Center on 108 West 146th Street. And so I think they'll be, just discussing latest updates around Legionnaire's disease and, if there are any community actions that are called for. Those will come up at the town hall.
Okay. And if there are, for those of us who cannot make it, I might be able to, I'm hoping to, but listen out for if we need another resolution. We have a very strong one now, but if we need another resolution or see what the task force wants to suggest, bring it back to the committee.
I have a question.
Okay.
Are we still, there was discussion of doing something to honor those?
Yeah, the vigil, I was just going to mention that. The situation that we're in with the vigil is how to do it, because I did talk to representative at National Action Network. They put me onto the law firm, but again, the law firm is only that's handling their legal case. The law firm is, concerned about having any involvement other than the legal.
No, they're not, they should not be involved.
Exactly, so that,
Anything having to do with vigils.
I got you.
That should be.
Yeah, but that was a one way of just trying to see if we can have contact with families. But National Action Network would be the best, but they're gonna just leave everything up. They already did a big presentation that got press coverage long before with Reverend Sharpton calls him the Attorney General of Black America, Crump. So anyway, that's been done. So one of the things we're thinking about, I mentioned it to Victor, I think we can still pursue it, but it will be a different time. It might be something that we could do in conjunction with someone else, but we're still gonna try to find the actual name. And we can still do it. I wish we could have done it sooner, but I don't think
you guys want to do this.
Yeah, if only we could find, I think maybe a couple, was there one name that was mentioned, one family member? Maybe not, but
I don't think we need to focus on names, because we're never gonna get all the names. But we can still have a ceremony honoring all the people that have died.
Right.
But so, it should be, we can't recognize the names, because no one's gonna give it to us.
Right.
So we're gonna die with on that. But I mean, we could still honor
Without a name,
people,
just-
the people, and the politicians can come and say, not only is this a memorial, but this is just to remind the community that this does not happen again. That's really what we need to do.
Exactly, yeah. Well, I mentioned that, I was more specific with Victor mentioning that, cause I, it's an idea that came out of this space, it can happen. But maybe we can just do it in conjunction with religious leaders, a variety,
Yeah, I mean,
churches.
People are upset about, we shouldn't have to go through the 17.
Right.
We shouldn't have to go through the 17.
Exactly. No, it's ridiculous. And like I said, and Monique, we were about to add something. Trying to say something.
No, that was the question. That was the question. What's happening with that? Are we gonna do something?
Yeah, we'll let
to honor
you know
those who passed?
where it, where there's an opportunity. And probably not, I doubt it, December, but maybe some February or January, around
Yeah, old bad
for another month, but we won't forget it. So
Okay.
give us till January, our first meeting of the year.
Sure.
In between that, we'll be talking about other things. And if you have other ideas, shoot me an email, we can bring that up, have it put together for our January meeting. But we have some ideas, but yeah, we wanted to give it a stab, the names, but it ain't working. So because of privacy, the family wants in the action,
Oh,
the
yeah, of
family's gonna
course.
take it. All right, the other thing, the issues of idling trucks and buses, what was very interesting is that last month, a letter, something was published, I think, on our website. And if any of you recall it, because I had this on our agenda for last month. But anyway, the word got out that one of the school bus companies that have been idling their buses in the neighborhoods, wherever in primarily the residential areas, got notice. Apparently the tickets mounted because the community started calling and saying, no, we're tired of this pollute, for buses being there to pollute. Those buses have a garage that they can go to right on the edge of Manhattan. Well, actually, I believe they're based in the Bronx. And Edwin, if you're still on, you can correct me on in terms of the location. But the city councilman, Sean Abreu's office, did send a note that they had been contacted by this bus company, and what they were doing was trying to mitigate their situation and be given a reduction in the amount that they have to pay for violating the law. So that I wanted to come up because our stance, as I talk to individuals anyway, is why? Because they're polluting the air and it's adding to all the pollution that's already there, and they've been warned and they have not complied. Right. Edwin, what do you recall for that? But bottom line, I think that's excellent, and that our community has started to respond. And so this.
And I was gonna mention, like, we didn't bring up to the committee that right now in 12th Avenue, if you go down there by where they have the MTA bus depot right before you go to the highway, it's full of buses and trucks. And people look at it and think it's benign, but all that is adding to the pollution that we all breathe here in this community. And I think that we have to take this serious, because then one wonders later on in life, why do I have a higher burden of cardiovascular disease, cancer, and many other diseases that is already very well documented in the literature on how this impacts health. And I think that the city has taken a very, lax approach for this, because the NYPD doesn't understand that, look, this is not only a parking violation, indeed it is, because they shouldn't be parked there, but the other aspect of this has is the impact to health. And I think that we need to be stronger pushing our agencies to pay attention to that. This is, go around Fifth Avenue right now. I used to work in Lenox Hill Hospital. You don't see this happening around Lenox Hill Hospital. In Lexington, Park Avenue, they will remove it right away. Why are we allowing that to happen here? Because they got more quote unquote social capital than us and power? No, we can't take this, because indeed all of our children, our seniors, and ourselves are negatively impacted. And it's right just right down the the block from where you guys are sitting in 12th Avenue, 135th. It's full of trucks right now, and all throughout the community.
And what I like though is that finally, I mean, the city council, I did call back, haven't gotten a response from them. But I think what's good about what we should feel good as a committee and a board about is that there's several things that we've acted on and gotten a response to. Accountability on the noise, the bars on Broadway, the whole thing with. I'm not saying it's all we need to do. We just got to stay on it. This issue that we have with the idling trucks and buses, And then even with the Legionnaires, there's been some action. It's just that doggone it, why doesn't it have to be always our communities? But
Yeah.
we're moving on that. So there's, we're getting some action. I think we're really trying, we have to demand more accountability. So I think we have to, I called the council member's office a couple of times. In a way, I'm not really expecting any callback. He may want to make some kind of arrangement or deal with them, Abreu. Because that was the one, the buses.
And I would, if we can, Laquita, add to this, that, the other thing is, I gone to UST and spoken to Lyle about putting signs in the community about the no idling and the tickets, and what DOT comes back and say, well, DOT comes back and say, well, we don't want to pollute the community with too many signs. I'm sorry, but I see other communities full of these signs saying that they will give you $2,000 ticket. So, when it comes to us, there's always an excuse, and we shouldn't take it. Like, everyone who lives here should be very upset about this because they're making us sick. That's because our eyes doesn't have a capability to see the pollution, but these buses are running in our community. They're staying in our community, and they
Those
shouldn't.
fuels are strong. Those fuels are very, very strong.
Really?
Thank you. You're right.
Really?
Oh, wait, there's someone who's at,
The idling everywhere.
someone else, whose hand was that, or whose voice was that also?
Hello?
Were they, maybe they were trying to catch someone before they had to get off. And I want to thank you, also, Dr. Edwin, for bringing this up and, during your tenure and, having us focus a number of times on noise and air pollution. So we're going to get on that. I had wanted early on in terms of accountability to provide our resolutions with certain project areas, and then give each of us something to work on, like just to examine when it's happened, responses, if they have been following everything. If not, we have to. I had wanted to have that at this meeting, but January, I still think okay. Hopefully I can get it out before January, and give us something. Select what you want to work on, because we have enough resolutions, and if we can get those passed, we'll have the quality of life will be really improved. Even if we get 50%. And I'm not saying settling, but I'm just saying we have some strong resolutions, and if they're adopted and we follow through or follow up on them, should make a difference. Cameron was with us when we were going around looking at scoping the neighborhood. And so there are some photos that we should have dropped. Cameron, if you could pull those together, that would be great to have. Yeah, you want to add anything else to what's been stated about the Ivan trucks? Oh, there.
We have one more minute.
Okay, so let me move on, because I don't think we can do it in a minute. Victor's, what is? You remain with us for 10 minutes. Finished. We're almost at the
Yes,
end.
I don't have keys though.
I have these.
Okay, so let's move forward quickly. Cameron. May have stepped away for a moment. Okay, Cameron is our liaison of two committees that are part of the planning, the grant for the NYC Community Planning Fellow. And Cameron put together a meeting with that fellow, Arnav Sahai. I don't think that Arnav is on with us this evening, because it might be a school night, actually. But Arnav is a fellow. Cameron put together a program that would help him follow what our interests are, and the committee's housing, land use, zoning, and then of course the health committee, because there are aspects of housing that impact on health. And so the two of us working together, I believe, committees working together, I believe the way it's set up is that how he will look into stipulations to supportive housing being in our area, how they came about putting so many of them in our area, and then the impact that has on the health of our and survival of our community. And with I think that Victor and the district manager got together, and were you also involved with that, Monique?
I was. My question is, so he has started officially?
He has started, and
Okay.
he put a meeting together. I think the meeting was 2 weeks ago, and it was on a Wednesday. So this may not be a good night for him to join us, but I'm hoping he can, and the camera will, introduce him next meeting. But Victor, anything else you want to add? It was a good meeting. Couple of words on that.
On meeting with.
The community planning grant and fellow.
Yes, no, very encouraging. Had his own ideas.
But he has formally started after that meeting.
Yes.
And Cameron put together a nice outline, and then as Victor said, Arnav primarily listened. He did ask a couple of questions of us. And so when he presents to us, he'll present whatever he's come up with so far. He's a fellow with us until June?
Yes.
I believe so.
Until June. And so if there are any comments to help him along to answer the questions that we need or are looking for answers to, or to validate some of the thoughts that we have had about what's happening with our community and the amount of supportive housing that has come in. It's not that we're not saying that we are against supportive housing. It needs, what I believe the majority is saying is that it needs to be spread out a bit. And we need to make sure that we can get some affordable housing in. Okay. Any other questions about that? Cameron, did you come back?
I'm here. I never left.
Oh, okay. So is there anything you want to add? I just complimented you on the outline that you had put together for the fellow, and you're acting as the liaison between the fellow, Arnav, and the committees.
Nothing to add. I can send out the proposal and deliverables to everybody. Everybody in
For our committee, that would be. Oh, if you send it to me, then I'll when I have some other emails to go out.
I'll send that out to you, and then if anybody wants to come to the next meeting with the fellow, I'll send out that invitation as well. I'm not sure if he'll be able to consistently come to these meetings. But if y'all are interested in meeting and hearing any progress on the research, then feel free.
Be good, and just let him know that we welcome him, and if he has any questions and wants to come any other time, he can. So do you have a sense of whether Monday at some point might be a good meeting time, like the first part in January? First meeting in January, I think it's January 6th.
I can
reach out.
Yeah.
We'll reach out to him.
We'll reach out to him. Okay.
Yeah, because he can also maybe attend an exec meeting or definitely a general meeting.
Well, other on a smaller scale for so you're going to get.
I don't think. I did. Well, at least let them come and just see the full breadth of what we do.
Okay, that's a good idea. Okay, thank you, Cameron. And so that's it under old business, unless someone else has anything else with old business. But I think we've, a lot has been accomplished. And then So just quickly, a resolution, to support Deborah Levine's proposal in support of full inclusion of public health and nursing degrees in the definition of professional degrees. A lot of women are in some of these areas, and people of color are in the public health and nursing degrees area. And the way, as Deborah presented it at the general board, will be left out with their wording. Lena responded to it. I'm pretty, Deborah and Lena, they have it going because they're both in this college environment. And can you speak of it very quickly to get the gist of it? And Deborah welcomed any input. And so we did hear from Lena. And if you all like it, we can put this together for presentation at the executive committee. Quickly,
What you have in your hand, you see the track changes are still there, the edits, which should have been cleaned up, so I apologize. But so I resent.
She just said she liked it. She just
Yeah,
said a note saying she liked it.
so I didn't know what that meant. So anyway, now you have a clean copy. But all I did was add social work, nursing, public health, 3 professions that are heavily dominated by women, heavily dominated by students of color, heavily dominated by first generation students, and people who are serving the communities that are most needed for these kinds of supporters are needed, and they're the ones that were left out of the professional school designation in Trump's bill, which means that getting graduate funding is going to be much more difficult for them to go to get these degrees. So if you're not a professional school, you now max out at $20,000 a year or $100,000 overall lifetime. If you are not a professional, if you are, it's much more. So people who we need doing these services can no longer fund their continues. So this resolution is to ask that to on trying to get it right to change.
It's so fun about it.
Everything.
He does have someone who's talented.
I know. Yes,
Public health.
Edwin has his hand up. Hold on, and then Malik. Edwin, I know you had your hand up for a while. I'm sorry.
I was gonna add, thank you for putting this forward, but I think that also we can add to this that this will further exacerbate the shortage of faculty, right? Because to become a faculty, you have to get your doctorate education. And by way of this bill, it will make it worse. We already have a shortage of nurses. The shortage for faculty is even worse. The average age for a nurse faculty is 67 years old. And, they're retiring, they just can't, do it anymore. And if this goes through, we're gonna be in a very tough situation as a country in a couple of years. So it's not only, getting your undergrad and your bachelor's and getting your master, but also those who are en route to become professors will be, undeterred by this type of, policy.
Okay, we tell Deborah thanks a lot for bringing this up and we need everybody's input because I never would have thought of that in terms of this particular issue because I'm not directly involved in it. It was great that Lena is, and she's also extolled, Deborah for bringing it up and had a couple other pieces. Will you take on adding in what Evan just said about the faculty?
Yeah.
A couple of sentences, probably all.
I'm sure you will faculty overall or faculty of color.
Yeah.
Already a small number.
Faculty of color.
And this would disproportionately affect, like Deborah said, communities of color, right? Because where people have more resources, they will still get the nurses because they pay more money. They will go
rich
to
white
those
kids will
places.
still be able to do these things.
Yeah, they will still, if you are, in Yale, New Haven, in certain places, certain hospital, in Greenwich Hospital, you're still going to have your nurse to patient ratio to be one of the best. Now, if you're in Harlan Hospital, your competition is going to look a lot different.
That's true. This is just really a domino effect.
That's a good point.
Really a domino effect. One thing affects the other.
I was gonna also ask about maybe small, because they say public health, other public administration would also count.
So they are, I think public policy schools are
as professional schools, which administration generally is under the guise of public policy.
Well, that's what I was looking at.
Yeah,
Yeah, I'm biased because I have an MPA, so,
I'm
and
pretty sure.
I didn't see it, that's why.
Just checking if not, we can add it.
Yeah, we could add it, because that is another route as well. In terms
And
of
then-
taking on the things that need to be done and addressing the issues that are, impacting our community and those communities that are usually medically
We
underserved.
really need to have somebody from Inspire's office of the general board to deal with this issue.
I agree. Once.
I hear him on television every once in a while, responding to issues, but it seems he's responded to immigration, which is important. There was one other one, but not to some of these others.
Right,
And I'm not sure what
somebody from his office.
I agree with you. I looked the other day and
Because there's nothing on his website, so he needs to come, his people need to come to our office.
Somebody
and talk about it.
you shot
Because I think he's actually
on this committee?
I want to say that
Exactly.
I think some of the education, health and education.
Oh, if he's helping out, we could certainly reach out and have dinner with John.
Sit on the side from his office.
Check his committee, but I'll just write it down.
Got it?
Espaillat.
Or
See what committees he's on. His representative hasn't come around this year. In the past,
Who's that?
he had, I don't even know now.
Somebody from his
Yeah.
office.
Yeah, we need to have them,
It's
maybe,
not consistent.
Yeah.
Let me.
what'd you say, Edwin?
No, this is a big issue. We have
Oh.
the social workers that, you had a few presentation here that if you don't have these professionals, will be severely impacted.
Yeah.
This will have a ripple effect that, the community will take years to come back from this because it takes time to train these folks.
Exactly.
It takes time to train a nurse that has a bachelor, but it takes more time to train a faculty. So if you create a shortage of faculty, that's just going to create a big problem in the system.
Cameron, I just see your hand up, sorry.
Yeah,
Or is
I don't have any comments. I think all the comments I agree with.
Oh, that may be a legacy hand then.
Hello? Oh, no, I just wanted to give a time check because I know we're at 8:38 and I just wanted.
Victor's here and Monique has a key, so we already checked
Are
it.
we staying all night?
No, we're not.
We're not staying on time.
Now, can I have a vote then to,
So we're just,
it's,
So I need to change this, right? You want me to make some changes,
Yeah.
including what everyone said?
but we have to get a vote tonight with the stipulation of friendly amendments. So how do we word it? Let's, I'm hoping there's a nomination to accept this letter of support directed to a couple of persons, actually. It will be CC to the legislators that have power.
Why
to
are
do
you
something.
sitting Cordell if she has a?
I don't know. Deborah mentioned it because there could be a state, I don't know. if
No, there's
a
no state anything.
What's
They're
the,
not.
what, did Deborah have her name?
No,
She had it here, yeah.
So we'll ask her what,
Yeah, there's no point. She has no federal.
But is it also useful to raise to our state
They're
legislature?
not.
Oh, there's
Our focus
somebody
not
trying to
touched.
say something. Is that Dr. Milano? What's that? Someone's trying to get through or maybe
Yes,
say, okay.
yeah, it's relevant. You don't need to.
You want this only to go to,
Let's ask
what
Deborah
about,
what her
what about our
thinking is.
assessors? Like, you
Yeah, no, that's what we need to put there. We
you want to put
Gillibrand
and.
and Schumer. Yes, SBI, Gillibrand and Schumer. Take for their.
So is that what you want me to do? Are you giving me
Yes.
permission?
And she probably, maybe she had a conversation, but they could be CC.
But typically, all of our elected officials.
Yeah, all of them get CC.
Yeah, but we're specifically sending it to the federal officials who are on these committees that can do something. SBI, Gillibrand and Schumer.
Okay, and don't worry about that, we'll add those in, if you could just get the,
The district office is all of them.
I mean, not for anything, even though like what's being said, federally, this is where the juice is.
Right,
The local officials should be made aware as well so that they
It
can,
affects our community.
yeah, it affects their constituents. And so, they should be trying to say something. Our Taylor can say something, even the senator, or whatever it's worth.
But the letters going to the federal authorities, they're the ones who.
Actually, it could go to them, but
So
I think we should copy it.
work that part, we'll work that through in terms of what, but right now, the resolution itself.
Right.
Can we say that with this, or someone make a motion? to
I
accept
make a
it with-
motion to accept this resolution with the friendly amendments that we are discussing.
And those friendly amendments are further, that without this, it further exacerbates the hiring of faculty or having adequate faculty. There was one other,
I think we're talking about you to look at.
Yeah, I don't see public policy or administration.
and
So
then
it also has been,
in that.
but it's also not,
Okay,
Meaning that it should be also
it
added.
should be added if we think we want to. And
I mean,
you're saying
I think it should be added, and you mentioned teachers.
Doesn't hurt to add.
No,
Teachers are on.
not. No, that's
no,
not true.
she's referring
It's not
to,
on the professional list, so we
right.
want it to be added because
Right.
teachers matter, right? Teachers also.
They're not talking about cutting teacher funding.
What?
let's look at what she's talking about there, the response to the
No.
Department of Education proposed definition of professional degrees.
Right,
So staying within that realm,
yeah.
let's look at whether public administration
not.
is there
It's
and
not.
then see if it should be added.
Right, so
Okay,
it's up to us, right? Do we wanna add that? And also teachers.
Let's-
Teachers are also excluded. They also
Oh,
have to
wow.
have
No,
master's
no, but,
degrees.
primary school teachers have limits. Education.
I think she's looking at professional
It's about
degrees.
graduate funding, right? This isn't
Right.
about undergrad at all. This doesn't think there's undergrad, it's
Graduate.
about
The
graduate
definition-
degrees. Because if you are not listed as a professional school, you will not be able to have access to loans, federal loans.
It's an attack on women.
Edwin, what?
Oh, this is a clear attack on women.
Absolutely.
You know, this
That's
is,
like-
We have to add what it is.
Administration's a little different because it's not so dominated by women like teaching, nursing and social work. I'm not saying we shouldn't include it. I'm just saying like, that's maybe why there hasn't been so much focus on that.
So,
But I'm not. saying-
so can we make those, we have a motion on the floor with two, friendly amendments, maybe three. We will all see this before it goes to executive, but at least we need a vote on it now while everyone's here with the amendments. And then we do it and then show Deborah also, getting to her as
So
well,
I'll just make
but it'll
those
be
changes.
coming out of our committee.
Well,
Any,
I made the motion, so is there a motion?
Second.
Thank you.
okay, Liz, motion by Monique, seconded by Liz. The letter of support will be pulled together by Lena.
Thank you,
And
Lena.
got to us so that we can circulate it to the committee. Hopefully before this week is out, and then get it to Deborah. And, I'm sure she's gonna be okay with it.
Right.
And then that's it. So all those in favor?
Aye.
Okay, Cameron and Edwin's public as well. We can take both of them. Cameron, you okay with that?
Yep.
Edwin, because we have Monica public and
oh,
you.
I thank you guys for bringing this up. This is, truly, national, but will have a direct impact in our community.
The actual.
Oh,
Consider the committee.
and
Actually,
then,
Department of Education.
oh, okay, that, then as soon as you send it to me, I'll get it to Lena tonight. I mean, before we leave here.
Then they
Okay.
get rid of that department.
No,
Hanging
it's
by a
it's
thread.
demo.
Yeah.
Hanging by a thread. Hanging by
There's
a
a website.
I thought they abolished it already. Oh, my God.
All right. Okay, so, wow, that works, and saved,
SPOT's on appropriations.
he's on, wow,
Oh, well, that's what Charlie had, right? That was the,
Yeah,
what is it?
appropriations, ways and means. Is that, if that's different from ways and means?
Ways and means is different.
Okay.
Oh,
he's
is
on
it? Okay.
Appropriations. Is he on health also?
It's appropriate.
Oh, that's still, okay.
That's money.
Yeah.
Money,
Okay.
money,
All right.
money.
So now, basically, we have to wrap this up. And my last thing, thank you, everyone. Oh, so we'll register the vote unanimous, actually. And we have, however many, let's see, Janera, I just thought I was going on with Janera.
Oh,
She's come to individuals like the executive and Janelle Ramirez. She's only been to one,
meeting, right?
yeah, but she's been to others, she's been helpful otherwise, but. All right, so in wrapping up, I just want to suggest, a return to our public health forum. And, we can discuss, I think the setup, and I apologize, I'll get this, the outline, that big outline I did for the public health forum out to everybody. But the idea, and I've been thinking about this since September, and, we talked about it's been on the agenda, but the first time, and it's not gonna be really thoroughly discussed because we have to wrap up. But anyway, next year is the 250th anniversary of the Declaration of Independence. And we've been doing so much. I was thinking that it could be winning the fight in the demand for equity and healthcare for all. There are some interesting things that happened from that doctor whose statue was taken down, how he used Black women for surgery without anesthesia, and bring that up to today. There's all kinds of other stories, whether dealing with sexually transmitted diseases, dealing with children and healthcare, vaccines. And then there was a movie I saw, Ross Cromer, on the story of Jews during the Holocaust, where there were these doctors that did all kinds of crazy stuff that you would never think of, and harming and
But
it's just all part, but yeah, everything. But there's a
You have Harriet Washington, medical apartheid, same thing. Talks about
Harriet Washington. Oh, you mean Harriet?
I think her name is Harriet Washington.
Lex.
What?
Lex.
Well, Lax, but Harriet
Lax, that
medical
was cancer.
I think it's medical apartheid.
Yeah.
So there's a plethora of stuff we could look at and pull from, looking at what things happen, atrocities, how we move forward, and how we have to pray that we don't go back to 100 or 250 years ago.
And we try to do without having
What else? Yeah, medical apartheid. Yeah.
And then, so what, talking about it, I think it's an exciting topic. We have a number of groups that are doing health fairs and all. We could bring some of our partners in, as we did last time, to show what they do and the services that they offer. But we will be educating our district, educating the public, and it should be exciting. There's a medical doctor on GMA third hour who is fantastic. And all of a sudden his name went out of my head, but hopefully we can get him as a guest speaker. Yes, his last name is Sutton. He is fantastic, but general information. And then of course we have a couple of them from our public health forum a couple of years ago. We have Dr. Williams up at Columbia Presbyterian. So what we have to work on, Victor, is a location for March, and we'll look at the dates, and hopefully
You want to do it March?
I think March would be good, like we did last time, and maybe toward the end of March. So if you all like that, I think we can do a lot. Bring it and maybe work out some credits. Is it called CEU or CUE credits? With City College, we have enough time now to get City College, maybe some of the Columbia urban medical students interested. There's some nursing schools. So we have that time. And hopefully we'll do as last time, invite our partners. It's a project we do together. It further connects them to us and gives us that great outreach, et cetera, et cetera. So all those in favor of this, we'll get well, we don't have to necessarily go on. We like it, we can go forward with it, and then I'll try to pull an outline together before our general board meeting. Oh, before executive, actually.
Oh, me before this executive or the one?
Yeah, because I have mine, I just have to fill it in before the December.
Yeah, because we have to reach out to people. May I say something real quick?
Yeah.
Did everybody saw this flyer?
Yeah, we announced it
Yeah,
earlier.
did, okay, then I'm hoping that we can,
You weren't able to be here.
yes, no, but I wanted to make sure it got out.
Um,
I hope to attend this session, and I'm hoping we can identify a CBO in our CV that could be eligible and apply for funding. I mean, that's the whole,
Don't you think of some,
so, I mean, so, and I was hoping.
when they hear it, they hear about it, I emailed it to 60-something people. We can email it again.
Yeah, just to remind people, so, and, they have sessions for prep, so that somebody can maybe be eligible to see the, funding.
Right, like we have, well, that's a great idea, great idea. Okay, it is now 9:50, I'm sorry, 8:50. Can I have a motion and thank you, sir, for coming to our meeting, and, welcome to come back again. So we have, oh, this is yours. Can I have a motion to adjourn us?
I just move. So moved.
I would like to say
We're moving the meeting to
unanimously.
8:52. And
Okay,
Lena is seconding it. Yeah. Hallelujah.
okay, let's see.
Here's the cards left from Ryan Health. Is there a place? to put them?
Thank you, everybody. Thank you, Monica, for coming. Thank you, Amber, for being on. Cameron, feel better?
You want a card? I'm gonna take a card. That's why I wear my mask. Taking a card, you wanna? Oh, I was down for a ride.
And thank you, Victor. And you're.
I have to lock up. I have to lock up, so we're gonna do it fast, right?
Yes, we carried over, because we couldn't.
Well, I haven't ordered it yet, so we need to get out.
It's a sticker.
Okay, so,
I think it's the offices, right? So we just shut down. I didn't know you were.
Is this coming
Thank you. I didn't know about
if you need to give email,
Silver Core.
come by this office.
I'm sorry, but it's said that.
Night.
Yeah, I just last week you were at the event. I don't even hear your name. I didn't see you because I got in late. Were you placed outside?
Oh, yeah, right there, bad phone number. Here, give your phone number. Put it right there on top of my coat. I'm
Oh, we can really